Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Hello there. We are glad that you're watching your favorite health talk show, a DocTalk show, with your host, Dr. Joseph Ogavu Jagenda. Are you aware that Uganda is a very young population, with up to half of our people being below the age of 15? Are you aware that over the years, our country has made so many gains regarding the prevention of preventable diseases? We are talking diarrhea, we are talking pneumonia, we are talking tuberculosis, measles, polio, among so many others that we used to sing, if you remember in primary, about those immunizable diseases. And arranges what we call integrated child health days that are held in the months of April and October. Joining me today is a very important person from the Ministry of Health, Dr. Alfred Driwale. I'm glad to host you. You're welcome.
Thank you.
The viewer wants to know, who is Dr. Driwale Alfred?
My name is Dr. Driwale Alfred. I am Assistant Commissioner in charge of vaccines and immunization in the Ministry of Health. And I also head the program, the national program for immunization.
I see that we have a very big and important person regarding our health. What does your duty really entail, especially in regards to vaccination?
The Ministry of Health, as its core function, exists to guide health promotion, disease prevention, treatment, and rehabilitation as immunization program. We also exist to reduce morbidity, illnesses, or deaths, or disabilities, which are caused by diseases which are otherwise preventable through vaccination. So our work is to ensure that we plan, we mobilize resources, we build the capacity of the healthcare system, we train healthcare workers, we implement the standards which are set, and we supervise. So this is what immunization work, which is done in the local governments. So that is our core function as a program, and that is it.
So is it really true that much of what inflicts pain and infirmity on Ugandans can actually be prevented? Is it possible to prevent disease, or you should just wait to treat it? And is cancer even preventable? Are some of the cancers preventable?
Yes, as I had stated from the beginning, diseases can be prevented by good action on things which determine health. Through good eating, good accommodation, good hygiene, exercise, good seeking of knowledge, early health-seeking behavior. All these impact on your health, so you can prevent diseases at that level. That is at health promotion level. The second is when the diseases are imminent, measures to avoid. For example, now we have COVID.
Yes.
And when you wash your hands, you wear a mask, and you maintain social distance, you are now preventing the disease. And as we may see in near future, you can also give vaccines to prevent a disease before it strikes you. And once now the disease has affected you, then you go on treatment. The treatment will have two outcomes. Either you improve,
yes,
or you succumb.
It's a reality
now,
of life.
Once you succumb, that's the end of the story.
Yeah.
But when you recover, you may recover with sequel. Then an effect which remains with you forever. And that is where the effects will require rehabilitation. So we diseases can be prevented. And also diseases which are prevented include infectious diseases, non-communicable diseases, the diabetes, the high blood pressure, they fall.
So by communicable, you mean that by being close to you or sharing so many things, including intimacy, one can be able to pass on
agents, and they move from one person to another. So, yeah, like malaria, like HIV, like COVID.
And what diseases are we talking about that we are targeting to prevent in Uganda? I know we have conditions that affect the lungs, some affect the skin, some affect the brain, and they cut across pregnant women, children, the old. Which diseases are we trying to target, especially during this drive?
So in Uganda, our immunization program has grown over time. From 6 killer diseases, now we are talking of 12 diseases. And you can see that now we can prevent diarrheal diseases, diarrhea which is being the second reason for hospital attendance, and also one of the leading causes of death, can now be prevented in childhood by vaccination. We also have 2 vaccines which prevent pneumonias. Pneumonias have been the second reason, the second reason ahead of diarrheas, which is third, as the reason for hospitalization and admission. There are 2 vaccines we provide to prevent that. And also diseases which affect the throat, the diphtheria, pertussis. These are diseases which the younger generation may not know, but previously it would cause a bag of pus in your throat, swelling of the neck, you fail to breathe, or you aspirate the pus, and death would result out of that. We also have measles and rubella. Measles, I think it is common knowledge, but there is also a generation who do not know it now.
And I'm one of those, actually. I missed my first case of measles, and it was seen by my senior. And
yes,
I had every reason not to know it because I had
it's not common.
Never seen.
It's because of vaccines. Then also tetanus, for which kills normally newborns who are born under unhygienic conditions, and also mothers following labor. Tuberculosis is another one of such diseases. And this is a disease which will be with you for a long time and damages the lungs. You may cough blood, you lose weight. It can also go into your brain, into your neck, lymph nodes, and so on. So this is another very severe disease. Vaccines are actually helping us prevent those severe forms.
In fact,
of this disease.
We are taught that tuberculosis is a masquerader. If we were in school and your senior asked you a question and you fail to find the cause, you would say TB.
TB.
and you'd really pass with flying.
Because it affects almost all organs.
Yes.
So you will be right whichever direction you go.
Definitely.
Yes.
So the Ministry of Health and government at large has put a lot of effort in vaccination, and we are really in high gear. There's so many campaigns, annual. If you look at our history, and since we got into these big drives for vaccination, are we making big gains? How has the country benefited?
So I think we are silently making groundbreaking gains in our fight against vaccine preventable diseases. I have not even added diseases like leprosy, diseases like polio, to other cancers which are preventable, cancer of the liver, cancer of the cervix. I have not added the list, so the list is long. Now, why we are insisting on vaccination is one of the most effective public health interventions, which produces immediate results at a lower cost. And you can reach many people with these interventions. So if you want to look at the impact of immunization, look at if you look at the numbers of our history. By 1988, of every 1,000 babies born alive, 100 would have died before they reach 1 year.
So that's 1,000. A tenth.
A tenth. But as we speak now, of every 1,000 babies born alive, at least by the time you reach, you check them after 1 year, only about 40 will have died.
Very big gain.
So this is a very big gain. And this big gain is translating itself into increase the life expectancy at birth. Now, when you produce a child, you can be certain that about this child can reach 63 years of age. But if you wind the clock backwards, around 1990, you would only say, oh, maybe you'll reach 45 years. Yes. But now you can be certain that this child will reach 63 for most of the people.
Thank you very much,
this is again.
Dr. Juari. You remind me of the days when women would tell you that, Doctor, I'm not so sure whether this child of mine will survive, so I must produce many followers, just in case the others do not make it. We are glad that we have many ways that can save us having to play a game of numbers.
But look, from where I come from, most names of children bear death in it.
Oh, yeah.
Drani, Dratele, Buni, Mutia, and so on. All these names, Chandia, yes. These are names, Drani, Dratele, Mutele, or Drajia. All these are names which are telling you all of them have died. This one is waiting for a turn to die, and so on. It depicts the high infant mortality rate. Oh, yeah. And if you go to those communities which used to name like that, you begin to see change in the pattern of naming. Yes. People are now giving love, lucky, yes. and so on. So this is telling you that through efforts to reduce unnecessary deaths of children, the communities have hope. And you can see the hope in the nomenclature, the names they give their children.
Thank you very much, Dr. Alfred, and thank you, viewer, for sticking to the DocTalk show. As you take this short break, stay tuned and send us your questions. We shall be glad to answer them. And we are glad that you're following us on our Twitter, Facebook pages, as well as subscribing to our YouTube page. I see you soon.
The Ministry of Health informs the general public that amidst the difficult times of the pandemic, routine immunization for all children under 5, those eligible for HPV vaccines, and women of childbearing age is still going on in all our health facilities. Parents and caregivers, take all your children for immunization as per their schedule. All vaccines are safe, effective, and free. Remember to observe the COVID-19 prevention measures as you go for immunization services. Wear a mask properly, covering your mouth and nose. Wash your hands regularly with soap and clean water or use an alcohol-based sanitizer. Maintain a physical distance of at least 2 meters from others and avoid crowds. This message is from the Ministry.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Senchu points when you deposit, send, and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go, MTN.
You are watching the DocTalk show.
Welcome back from the break. Very interesting discussions, and we are seeing your questions coming in. I'm sure a good number of them will be answered before this show ends. So, Dr. Juari, as Minister of Health, and you in particular in charge of vaccines, and you have the Integrated Child Health Days, a bit of the history. We know we've had routine vaccinations. But when did the ministry now think about having these integrated child health days? Very short period, but big impact.
Yeah, you know, the immunization services in this country has been evolving over time. The program was established in 1983.
Oh.
But before that, there was no established program that a child born has immunization as an entitlement to protect him or her from a certain set of diseases which were known. So what was happening before that was you get an outbreak of measles in one corner of the country, you get a humanitarian response. You find polio outbreak in a certain area, you get humanitarian response. And if there is no outbreak, you stay.
Oh, yeah.
You get the measles, it affects those it can affect, and leaves
The
those
ones who
it can
survive,
leave.
they go away.
So it was this chaotic kind of approach to service delivery. But the year 1983 was a year when this country was in turmoil. The economic situation was not good. Health system was weak. And in terms of even availability of services available, it was very difficult time. So the program, with good intention, could not take off. Now, in 1987, the government which came to power, which is NRM, they had prioritized prevention of diseases as one of the items on the 10-point program. So when they found there was a program which was not being well managed under the circumstances at that time, it was prioritized.
I see.
So His Excellency relaunched the UNEPI program, and it galvanized the support from all actors, WHO, UNICEF, and other actors, so that it was clear that the 6 killer diseases were diseases which were now prioritized, and every child born should be systematically provided this service.
I see.
Now, along the way, we have been struggling with ensuring that every child is vaccinated. Our figures have been growing over time. Out of the 100% children targeted, you would start from 35, around 80, 85, 86, 35% to move to 60. Now we have reached a point where the coverages are stagnating at around 85%.
And that's somewhere.
And that is that is now closer to target. But a country which is very stable, a country with well-set systems, very highly decentralized structures, we are not using all the apparatus available to us to reach every child. So what we do during the Child Health Days, this is something now which came up in around 2000, 2005. It came up as an effort to boost the effort to reach every child through an intensified activity, where you say, let's get closer to people, let's mobilize specifically for this activity so that every child has access to this service, including other services for mothers, and including health education services for the community. So the Child Health Days were born so that you provide an integrated package of services for maternal and child health and survival.
So by getting closer, you mean you go to schools, you go to places of worship, you go to the health centers.
Yes.
Where do these activities actually take place?
Right. So for good service uptake, we look at the supply side of the health system, where the Ministry of Health and government, they put resources and acquire the supplies to reach people with services. But at times the communities do not go to the health facility. The communities do not go to the health facility. Therefore, we are providing a unique opportunity to be closer to the communities themselves, so that we take these services where they are not available closer to the villages. Closer to the villages, we mobilize parents and caregivers to bring children to places which are designated closer to them, and we involve local council to mobilize. We also involve village health teams. We involve parish chiefs and health assistants to ensure that when the health facility staff go to the community is ready to receive this service.
I see.
So this is now the intensification. And also for this particular period, we have also reinforced and instructed all health facilities to provide immunization services daily. Our observation has been that some facilities with all that is required to provide services, vaccinate once in a week.
Or once every fortnight?
Once every fortnight.
Or they make a monthly visit
exactly.
to the outpost.
So in this way, the investments we make as government in health facilities, in cold chain and so on, lay redundant. So you're only using about 15% of the capital or fixed investments for immunization.
So that means any day, any time is immunization day,
exactly.
Immunization time.
So that OPD, a child who's brought to the OPD, even if the reason is malaria,
yes,
the clinician should also say, this child is below 1 year, did he get vaccination? Looks at the card and refers the child to the immunization wing, which must be functional at that time. And also from the wards, also from the maternity wards. So this is an intensified activity, and we would want this from now on to continue in this way, so that we reach every child. There is no excuse for any child in Uganda not to be vaccinated, because it is possible.
I see. If you're interested in the age of the host knew the answer to what is UNEPI in full, and he was born in the year that the program first failed until it was rejuvenated. So that's a trivia for you. You can work out the host's age. Impact of COVID. COVID has been with us, and definitely the first half of the year has gone very much to the impact of the lockdown. How much has this affected vaccination efforts in the country?
So once again, I want to say our health systems are resilient, because during the lockdown, we did not see total interruption of services. Services continued, but we saw reduction. We saw reduction by 21% in the month of April, but there has been significant recovery since that time. So what we see is that out of the 21% reduction in immunization coverage, only 6%, we observed 6% in the immunization levels carried out in health facilities, static points.
I see.
What was affected was outreach, and we saw a reduction by 15%, making the 26. So this COVID impacted on not reaching all our targets of that month of April, and but the subsequent months we have seen a catch up, and the children who were missed, many of them are coming, but not all of them. And in the month of October, we are putting specific emphasis to ensure that the children are brought, and we update the immunization status moving forward.
Oh, thank you very much. How are these days different from routine immunization? I mean, if I'm a parent and I follow to the dot the national immunization schedule, and my card is ticked with flying colors, is there any other benefit for me coming to these integrated child health days related to that may not be necessarily related to vaccines? Is there any other benefit for me as a person?
Now, integrated child days, we said it is for catch-up, and it has a service package. So routine immunization is one. Deworming of children below 15 years is another. For children who are 10 years, we are vaccinating against human papillomavirus, the major cause of cancer of the cervix. For regions in the Ankole, Toro, greater parts of Buganda, the southern part of Buganda, and Ankole, Kigezi, we are specifically, in addition to this package which goes to other parts of the country, we are introducing hepatitis B screening and vaccination. Those who are found positive will be further investigated to see if they require treatment. Those who are negative will be vaccinated, so that hepatitis is not any one of their diseases moving forward. We will only encourage that each person should complete the 3 doses which they have started. For children who are below 5 years, we are also providing vitamin A supplementation to against the preventable cause of blindness.
So I see that you have a very big package coming up for us.
Yes.
Dear viewer,
Yes.
Don't go away as you go for this short break, because I have something for the young, something for the middle-aged, even the older persons. We have a package for you that government is planning, and it's good that you actually participate. You do not need to be a child to go for these integrated health days. You will benefit in getting screened and go away with a vaccine that might save you from a very serious condition, such as cancer of the liver or scarring of the same organ. So as you go for the break, we hope that you will be fine. Keep social distance, put your mask on, and sanitize your hands or keep them clean. COVID is here, but life must move on, and keep safe.
You are watching the DocTalk Show.
Echa COVID-19 chijja kugwa only if we stay at home, observe physical distancing, wear masks properly, sanitize or wash our hands with soap and water regularly, or get vaccinated now.
You are watching the DocTalk Show.
Welcome back from that short break. It is me, your host, Dr. Joseph Ogavu Jagenda, and with someone from the Ministry of Health, Dr. Alfred Tuale. Doctor, I'm looking at cancer of the cervix. My area of practice, nephrology and internal medicine, I see quite a number of women who come in rather late with a diagnosis of cancer of the cervix, cancer of the womb. And it's quite a very debilitating disease with many complications, which are very difficult to manage and very demeaning of anyone's stature, and very expensive to manage. I mean, you're talking about someone needing dialysis for the rest of their lives, or needing very complex surgery to try and save their lives or get them to function better. Again, what targets are we looking at for prevention of this cancer of the cervix, especially through vaccination with HPV?
Yes, Dr. Gavo, I think the crux of the matter is the diseases which have been prioritized to be prevented through vaccines are diseases which once get somebody, there is hopelessness in the treatment and the outcomes. So the best is either to invest in health promotion and disease prevention. So the promotion side will be adaptation to behavior and behavior. For example, cancer of the cervix, we know that its occurrence is, there are associations. Early sexual debut, starting sexual activity early is a risk. So by behavior, it is good to delay.
Yes.
Number two, multiple sexual partners is a risk. So it is also good to delay. The parity, having multiple pregnancies is also a risk. So through family planning, adaptation of behavior, you can actually prevent the disease at the health promotional level. The one now we are talking about is, we also know that the cancer of cervix is caused, there is also a very strong association or a cause with the human papilloma virus. HPV. Now, we know that this is one of the interventions, this vaccine, into our routine immunization program about 5 years ago. Now, the earlier children did not have this opportunity. now the children we are having, this should not be one of their diseases.
And we are looking at the cancer that actually is the commonest cancer in women. That's cancer of the cervix. Mark you women, every woman that has normal anatomy, you probably have a uterus. And that means you stand a high chance of getting cancer of the cervix. So every woman has a chance of getting cancer of the cervix, and they want you to be patriotic and actually play that part. As we go for this short break, I'll be waiting to answer your questions in the next segment.
Show profiles Uganda's healthcare sector. On the DocTalk show today,
like a first car on a mission, the Uganda National Health Laboratory Services is on a mission to provide accurate, reliable, and dependable diagnosis to disease prevention, management, and control. As the experts explain in the following expose.
I'm Semana Patrick, a laboratory technologist working with the National Biorepository. In the National Biorepository, what we do mainly store remnant samples that are worked on up in the lab, but also the National Biorepository is open to the public. We have different universities, different hospitals and research organizations that store with us their samples. We have different capacities of storage ranging from room temperature. We have -20, the fridge temperature, and -80, but also we have liquid nitrogen.
I'm a lab technology supervisor, and this is the EID lab, early infant diagnosis. We work on samples from infants that are aged from 6 weeks to 18 months that are born to HIV positive mothers. The importance of this is for early detection of HIV so that they can be managed well early enough. So this is the EID lab. It is majorly a 24-hour lab. We work on DBS samples that are brought from across the country. They come from across the country through the hub system. They come here at CPHL and they go through our system, and this is the lab area.
Our cold chain storage, we store different samples. We store HIV samples of different categories and from different regions. We also store samples from outbreaks. The Ebola outbreak, we have Marburg samples and the different microbiology isolates.
Basically, I use the real-time PCR to work out on our samples, and these are the machines that we use. So this is Cobas AmpliPrep. These are the machines that do the real-time PCR, and this one does the RNA extraction. It is the AmpliPrep, and this one does the detection and amplification. So they are interlinked by a docking system.
We also have, under storage, we have samples of hair from different study groups. We also store dry blood spots that are used for different purposes. For example, we have research universities that come to pick these samples for the different research that is conducted.
Yeah, we have a computer system. It's called Cobas Ampli. It links both the AmpliPrep and TACMan. So these machines process like an average of 800 samples on a daily, 15,000 samples.
We put them in small vials, and then put them in a box so that they can fit in these small boxes, and a good number of them. But also organizing them in this order enables us to easily retrieve them. In the event that there is someone that wants these samples to be used for research, it becomes very easy for us to retrieve these samples because we have a system that is used to retrieve these samples depending on the boxes and the positions where these samples have been kept.
So when the samples come here at CPHL, they are received at sample reception, and then they are approved, and then they are entered into our systems, and they are brought up for sample processing and for sample processing. So when they come to the lab, we first do the sorting process from that other side of the lab. After sorting, by sorting we are basically verifying the sample IDs and form details to see whether the right sample that we are going to cut is the right one, so that we don't give mismatching information. So after sorting, the samples are cut and then they are brought this side of the lab for loading.
So this freezer is at -80 and it can store these samples for over 10 years. We have samples in storage for between 5 to 25 years, depending on the research and the sample type that we are storing. So we have about 16 of these -20s, but we also have the -176, that is liquid nitrogen. For an extended period of storage, there are samples that we store in liquid nitrogen.
This machine, the ampli prep, basically takes around 3 hours, and Tuckman takes like around 1.5 hours to do its amplification and detection. Yeah, this EID lab has been, we've been affected by COVID. Has affected our turnaround time, has increased. You know, we give results in less than 4 days. But now this second wave of COVID has affected our results. Like the past month, from the month of June, we had 60% of our staff that were set on leave because of COVID. So our turnaround time has been, it was affected. It increased from 4 days to 5 days, but now it's now normalizing. Now we are okay.
The Ministry of Health informs the general public that during this COVID-19 pandemic, we should not forget to take our children for immunization. Parents and caregivers are reminded that the immunization services are still accessible at all government health facilities. Please take your child for immunization on time. All vaccines are safe, effective, and free. Remember to observe the COVID-19 prevention measures as you go for immunization services. Wear a mask properly, covering your mouth and nose. Wash your hands regularly with soap and clean water, or use a DocTalk show.
Patriotism is a feeling of love, devotion, and the willingness to sacrifice for one's country.
I say no to corruption because I put my country first. I choose peace over violence because I put my country first.
Patriotic, Uganda first. This message is brought to you by the National Secretariat for Patriotism Co-Uganda, Office of the President.
You are watching the DocTalk show.
Now, Uganda, lucky as we are, we have a prevalence of 4.7 or 4.6 thereabout of hepatitis B. Now, that alone is not a problem. But the fact that this condition can predispose you to serious conditions like liver cancer and scarring of the liver, which we want to call liver cirrhosis, makes it a very important thing. And the country is actually trying to beat so many targets. And this is talk we've had from years back about hepatitis B. You're choosing some specific regions in this country. And to mention, we have Chigezi, Nkole, Tororo, Bunyoro, and Uganda to specifically screen and vaccinate against hepatitis B. What is driving this?
Okay. What is driving this is in 2005, a seroprevalence survey was done, and it was found that hepatitis B was mostly had high levels of occurrence in the West Nile region, in the north, and in the east. So the Ministry of Health started interventions against hepatitis in those areas to screen, to vaccinate, and enroll into care. Now, we moved in phases, phase 1, phase 2, phase 3. The regions where we are now are in phase 3 and phase 4. And this is an activity I would appeal to the people in those regions to take very seriously, because hepatitis B is a disease which is already targeted globally for elimination. And hepatitis is more serious, it's as common as malaria for us in the Asian region. So globally, there is a lot of focus, and it is proved that we can actually eliminate this disease. Now, the global target is that by 2030,
that's 10 years from
10
now.
years from now, of every 1,000 people you test, you should only find in one person. 1,000 people.
That translates to about 0.1?
Yes, that's 0.1%. Now, this program for vaccinating against hepatitis started in Uganda in 2002.
We are looking at 18
years. So the children, Ugandan children who are 18 years, the Bazukulu,
yes.
This age group is a unique age group, because if you screen them for hepatitis, you will only find, the prevalence now is 0.6.
So that's proof that the vaccine is actually working, because they are getting it from the time they are born.
Yes.
And by the time someone makes 1 year, they have got a full dose of hepatitis B protection.
Yes. And this is a very high success, because if you check hepatitis in that group, you only find 6 out of 1,000. But for us, you will find about 40.
Oh, yeah.
You will find 46 out of every 1,000.
The 4.6. That's more prevalent than people that have diabetes in this country, because diabetes is about 2.2, 2.3.
Exactly.
But you see how much suffering it causes.
This is big. So you see that the age group which is vaccinated through the routine in childhood, they are safe. Now we are moving for older people, 19 years above, who did not benefit from immunization. We test them. Those who are found positive, we will work them up and start them on treatment. And the treatment, the medicines are there.
It's available and it is safe.
And safe.
You begin it early.
And even manufactured in Uganda.
In Uganda, yes. We are among
with
few
the guarantees
countries
from government. We are one of the few countries in Africa which manufactures this medicine. Now, those who are found negative, we will vaccinate. Will vaccinate them, so that hepatitis is not any one of their problems. So the areas which we counted, the Toro region, Bunyoro region, Buganda region, Kigezi, and Kole, these areas are where we are now focusing. In addition to the package of the integrated child health days, we are also screening. And the child health days is just used as the start, and it is supposed to continue.
So the country is making very big gains already. Yes. We are ahead of our targets. And you who have not been screened, please show up and get screened. If you merit the vaccine, you definitely get it. And the good news is that government is providing medication that is safe.
Actually, we have surpassed the 2020 target. The 2020 target was to have 1%. But now in our Bazukulu, we have moved to 0.6%. So
an extra 40%.
Yes.
So we are doing.
And 2030, I'm very sure we will have attained that elimination target.
Thank you very much. What do I stand to gain as an individual? Can't I live with myself unvaccinated? Does it affect my country and community in any way?
Now, this is, we look at it from individual level. When you have a child with any of these diseases, we are protecting against, starting from leprosy, TB, the whooping cough, diphtheria, tetanus.
Yes.
Myself, the first time as a medical student, I saw a man who was suffering from tetanus. I went to the antenatal wing. I went to the antenatal wing and started. I asked for tetanus, so a vaccine to be given.
Yes.
So it helps you as an individual to be sure that this is not any one of your conditions in the era of road traffic accidents and so on. it protects you. And then
as a country,
as a community, when you lose a loved one, or when you have a relative who needs to be taken maybe to India because he has a cancer, he's going for liver transplant, it is few people who can afford that.
That's when
so it will hit the family unit. Some people sell all their savings of life to treat someone who is also going to pass anyway. So it's a very painful side of things there. And as a country, when you are treating abroad, you are going to have to send out your forex earnings. You are going to spend outside, and money which you would have used for educating the citizens, money for developing, will be moving in the wrong direction. So if you prevent, it benefits all the levels: the individual, the community, the family, the community, and the country.
So dear Bazukulu and the parents, there's everything to gain in having your child and yourself protected from these killer diseases, so that apart from getting sick, we can go and do other things. We can enjoy our parties, or go to your home in the village. You can divert those resources and put them to very good use. Dr. Juwali, and you speaking as the Minister of Health, the country is watching. What message do you have for these health facilities? What message do you have for that leader down at the grassroots of this country and these regions that are specifically being targeted? What message do you have for the schools and for the parents? What part are they supposed to play in the weeks that are remaining before we conclude this month?
So my first appeal is to the parents, because this is an intervention to save our children, to ensure that they are safe, they are healthy, they do not have preventable disability, and they grow to their full potential, because they are our future. Future of the country, future of the community, and future of the family as well. So the responsibility rests on the individual. And as it is in the Constitution, it is the individual responsibility to do what it is, what is required to keep healthy, to promote health and prevent disease.
So the parents are allowed to take it personal here.
Yes, you take it personal because it is a personal responsibility, and it borders on responsible parenthood. So that is my message for parents. The second message I have is for community leaders. The community leaders, mobilization of communities for health services, for disease prevention interventions, is a service which as leaders we are to provide to the community and show them where these outreaches are supposed to be organized, and also provide support to the healthcare workers who will come to that area and need communities to be calm, to be organized. Water will be required for hand washing. People have to observe social distancing because of COVID. So to keep it scientific, that is where you can help you can help the health workers. So these are the village health teams, LC1s, parish chiefs, and health assistants. Now, the health facilities, we are asking two things out of you. Number one, make all the effort to ensure that you visit every parish under your jurisdiction 2 times in this month. Even if you cannot finish them in these remaining 2 weeks, you can spill over into the month of November. Number two, ensure that immunization services, and indeed the package defined in the Integrated Child Health Day, are provided on a daily basis, so that you do not miss opportunities for people who come to the facility for other reasons. They should also benefit without having to go to another area.
Thank you very much. We are waiting to see you at these Integrated Child Health Days. You don't need to be a little child, even adults. There's a package for us that we shall get. Dr. Juwali,
yes, sir.
We are a country that is proud of our scientists. And COVID is here, but we are not quiet. We've staged the fight. And I'm sure we are having so many efforts to have a vaccine running. What steps have we taken? How close are we to getting?
Yes, this I think is one of the rare moments to be proud of our country and the effort we have put in containing the disease and flattening the curve. But now we have moved into community transmission. This calls for more action from individuals. And we must continue wearing the mask, social distancing, and sanitizing. Vaccines, the global community is making a lot of effort in ensuring that vaccines are available and also ensuring that people get the vaccines regardless of whether they have money or not. And these discussions are ongoing, and the timelines we have for a possible vaccine deployment, not the research side, use of vaccines for COVID prevention, that's close enough.
What you have to do is to keep your social distance, sanitize, wash your hands, and put on the face mask when you are out in the crowds and not with family. Dr. Juwale, what are your parting shots?
My parting shot is that the services which we are providing is our commitment as a country to ensure that we reduce preventable sicknesses, disability, and death. And immunization program is one such a disease prevention intervention that has results which we are harvesting. So I would encourage parents to listen to sources which are authoritative as far as immunization work is concerned, as opposed to picking clips which are on social media and at times very diversionary. We will inform this country when we have any information which is not satisfactory.
Thank you very much, Dr. Juwale.
Thank you.
My viewer, you have a chance to prevent 1,200,000 cases of cancer of the cervix. You have a chance to screen and treat people with hepatitis B and C. You have a chance to prevent 17,300,000 Ugandans from walking around with worms. Please take a chance and go and participate in these integrated child health days. And together we shall have a strong country. And together we shall grow and transform the world and transform our lives. Till next time, Dr. Joseph Ogavu Jagenda, your host. Thanks for watching the DocTalk Show.
The DocTalk Show.
Bueno, yaba no mojo, yaba no wishi. I don't know. If it is a boy, I'm going to be calling Hakatabaz. The garo ret nyana naza kumani eming. Otio, can't take anything grave. Ay. Riama katutumto. Ay. Essa guazara mwisho. Otio. E hata no kujenda. Sleep like a baby at home. Yeah. Thank you.
Katoto. Hold on. What about immunization?
No. Nga. Immunization bossy. Entuzaku chikoro wanyi.
Katoto, your son is a citizen of Uganda now. Atogu no mwana witu. Our government has assured that all these essential vaccines, they are free. To us.
You mean immunization is free?
Yes. So we have made sure that there are several health center units where you can take Katabazi and he gets essential vaccines. Before Katabazi reaches the age of 13, he will need to receive immunity against polio.
Polio? Whooping cough.
Tetanus, measles.
Yamawe, measles,
hepatitis, influenza. No. The government will even support you by giving you free mosquito nets to help fight against malaria.
Umwana kazarerwa.
Yes.
Amurere maura down koda. Yeah, yatunga immunization.
weekend on UBC.
Achieving something can be a widely exhilarating thing in life. But then if you're flirting with the idea of giving up, you could be throwing up something very important. This man I have on the show has been dragged through murky waters of politics, through everything, but he has turned out to be very victorious.
Yes, I just come back to the SEC after a leave of 5 years. I'm back, and definitely Kampala needs a vibrant leader like me who will mobilize for NRM and be able to counteract the waves which always come as a storm to Kampala.
What actually keeps you motivated? What keeps you going even when you fall down? I mean, where do you get this tenacity from and the courage?
You see, I am a person who believes you should never hate your enemies, you should like your enemies. The more potholes your enemies dig for you, the more they wake you up, the more encouragement they give you, and they open your mind towards bigger things. My bulijjo ngamba abantu.
Yes.
Ndi Muganda naye Katonda yanzija mu oven nga tannakunjokya bulungi. Yansikamu mu oven nandeka kale eno netanjokeza bulungi.